Welcome to CEO Money. I'm Michael Yorba on location in Laguna Beach. I'm talking with Todd Malan, Dr. Todd Malan, and he's the founder and chief science officer for the Center of Regenerative Cell Medicine. Todd, welcome to the show.
Thank you very much. I'm happy to be here.
I'm glad you're here too. All right, you're doing breakthrough work here. I wanted to hear all about it. Give us some background on the Center for Regenerative Cell Medicine and what you're doing to change the world.
Well, it's really been a fascinating journey for us. In 2009, we started off as the first center in the United States to start using these adipose or fat-derived stem cells. But at the time, we were really just using them for reconstructive surgery because we didn't understand the full capacity of these cells for healing and repairing tissue all over your body. And it was really through those studies in which we were just trying to help patients with wound care and with severe burns that we started to see all these amazing changes with their joints, with their autoimmune diseases, with nerve repair. And so it's been fascinating to watch the changes and to see the increase in knowledge. I mean, at the time we started, there were 2 or 3 articles or publications about these types of stem cells. Now there's dozens a week. So it's really been the fastest evolving growth in medicine of any one type of medicine that I've ever seen in my career.
Tell me about your work with chronic illnesses. I want to hear more about that.
Well, when it comes to chronic illness, we've understood this. The approach really needs to be understanding the mechanism of disease, understanding what is the underlying cause, what are some of the factors involved. It's amazing now that we have things like the Human Genome Project, and we understand genetics, and we understand that genetics are not on or off. They are partially activated and partially disactivated by certain things in our environments. We really try to understand our patients from the standpoint of looking at the genetic aspects, looking at their micronutrients, looking at their dietary decisions and lifestyle change decisions, and trying to determine how those could have mostly impacted in their disease process. And then the nice thing about stem cells try to treat the underlying process. So it's not just about repairing the damaged heart muscle. It's about repairing the blood vessels that feed that heart muscle. It's about repairing the overall ability for the body to balance its electrolytes and all the different aspects that go into making the body function more normally. And that's really what stem cells do, is they are our master regulator. So they're not just focusing on repair, they're also focusing on enhancing the way that our cells communicate. So that regulatory process that keeps us in balance and allows our body to maintain or achieve its highest level of health is really important when you're treating chronic disease. So we don't treat symptoms, we treat the individual.
Brilliant. Well, tell me about the difference between what you're doing and what other people in your industry sector are doing.
Well, a big part of the advantage of being one of the first doctors in the world to start doing this type of science or technology is that it's a small knit community of experts worldwide that are working and struggling to try to really understand these cells and understand how they can be best applied for an individual, regardless of whether it's an acute disease process or, again, chronic disease where we focus our attention. And so that little small net community, I'm lucky that I get to spend time in Europe and I get to spend time in Asia, and I'm able to work with experts around the world. So what we're able to do from those experiences is bring back the latest technology. So some of the technology that we're using in our practice is 10 years ahead of anything else being used around the United States. And that's simply just a matter of going out, working with the experts, joining those studies and trials, and bringing that technology back to the United States.
What part of the world are you seeing the most advanced studies in stem cell research?
Right now, it's really a neck and neck between Japan and Europe, Western Europe. They really are pushing the boundaries every day, and it's really tough to keep up. I mean, it used to be that I could plan on going out once a year, and that would be enough for me to update and keep up on what was happening there. Now it's gotten to the point where if I'm not out there every 3 to 6 months, I'm probably going to be behind the next iteration of change. So, I mean, they are doing anti-aging medicine there, where they're seeing they're seeing good study data that is supporting the fact that just using stem cells just to help support your overall sense of well-being, your memory, your concentration, repairing old damage to your blood vessels and plaques that have developed over the years. So you can imagine with all the different areas that the stem cells can address, you never even know in most individuals what you're preventing down the line because you're treating it at the time you're treating the stem cells for another indication.
So I guess I would call them probably, very, let's just say that uneducated questions, but something that we gut level in general. So what about, you mentioned anti-aging. So it seems to me that if you could take stem cells from a younger person, put them into an older person who's got the wisdom, who's like, well, I know where the bear trap is, so, and be able to get that to take hold, and then also be able to eliminate or greatly reduce the chances of the normal diseases that older people get, because cancer, for the most part, hits somebody later in years, and being able to increase their mental capacities. Are we at a point where those types of combinations can start to generate superhumans again?
I think we're getting near that point. They've already shown studies where by simply transfusing blood from a younger person, because that blood is going to contain growth factors and cytokines, and just by doing that alone, you can improve a lot of the aspects of aging, meaning the measurable markers of inflammation and changes that occur. We see now, the one thing that we're seeing about the stem cells is that first and foremost, the stem cells that we're using are the adipose or fat-derived stem cells. And the reason we use those is because those are fat cells that have been in storage your entire life. Mm-hmm. Why have they been sitting in your fat doing nothing? We don't know, but they're fresh. Whereas your bone marrow stem cells are constantly being copied. As you burn bone marrow stem cells on a daily process, your body has to create copies. And those copies of copies of copies of copies, by the time you're in your 60s and 70s, virtually all of those stem cells have been copied at least 5 times. They have a very decreased potency. So we think that the adipose cells are basically your youngest version of stem cells in your body. And by utilizing those, it tends to be that your own stem cells speak the same language as the rest of your body. And so they do a better job than other person's stem cells. I can give you somebody else's stem cells, and they do help with especially inflammation and starting the repair process. But the really difficult thing for stem cells to do, which is that cell-to-cell communication and improving the way that all of the cells work together, that's something that you need your own stem cells for that process.
So are we at the point now where we're taking stem cells out of babies so that later on in life we can re-inject them and heal them from, say, slow down the aging process or increase the mental capacity process?
It's probably not a bad idea. It's not being done widely. There are some studies that are underway, and even University of Miami has had a study with frailty where they're just giving stem cells to patients over the age of 70 just to see if it has any benefit for them. And then in Europe, of course, a lot of these studies are going on. I mean, it is quite it's a really hot topic at the time. I mean, if you look at some of the studies that have shown that the wealthiest 1% of the population would spend virtually all of their money just to live another 10 years. And that, and especially in Europe, 50% of the population expects to live to the age of 120. So you've got these folks that have these great expectations for living longer lives, but they want to live healthier lives, and they want to live lives in which they're not dealing with these chronic diseases. And that's what we're seeing. In these animal models, you're seeing animals that are living 3 to 4 times their normal longevity, their normal lifespan, through the treatment with stem cells. And that's using human stem cells to treat them, not their own stem cells.
Part of this is going to be expense. So the wealthy can live forever. I mean, they've even got a TV series about this. The wealthy are immortal, and the poor are, food.
Yeah, yeah. That's. I mean, they're. Even when you look at stem cell therapies, if you look at the full the full aspects of how stem cell therapies could be used today to treat as many conditions as we potentially believe they could be treated, imagine the entire medical economics that would need to change. Because now you're talking about throwing into the environment something that cures disease versus just treating disease, and you're changing an entire paradigm in the way that we do medical care and treatment. So as our technology begins to really improve the ability for us to improve our quality of lives, we're going to need to make adjustments in the way that we pay for these services and the way that we pay for this increased longevity.
Well, how are we going to do that? I mean, what I'm trying to understand is the expense of this. So let's say that I want to rid myself of as many diseases as possible. I want to expand my mental capacity, and I want to lengthen my life here on Earth. Well, I mean, those are three of the main things everybody's going to want. How much does that cost? And how can I pay for it?
Well, the therapies themselves, the therapies themselves are not that incredibly expensive. I mean, we're talking about therapies that are typically in the $10,000 to $20,000 range, and how often those would need to be repeated, we don't know. But we think we're looking at a 5 to 10 year span between these therapies. So if you can imagine that, I mean, that's there's a lot of people that type of a budget in $1,000 over a 10-year period is very reasonable. The big issue is people, how have they planned to be able to survive that period of time, 120 years, and still be able to support themselves?
Right.
Yeah. That I don't know.
Okay. Well, there's a lot we have to figure out, but at least you're making the breakthroughs. I mean, that's brilliant. I just one last question before we part ways. Why is Japan and Europe so far ahead of us on this study?
Well, the crazy thing is that the basic science that discovered these stem cells was actually done at UCLA back in 2001. But at that time, we had the problem with the Bush presidential order, which banned stem cell research.
I remember
So that banning of stem cell research that included your own stem cells, not just embryonic stem cells, we basically shipped that technology off to Japan and told them to get started until we figured out how to do it in the United States. And so virtually every other developed country in the world has about a 15-year head start on this from the standpoint of not technology. We have the same technology today that they have. It's the approval. They're 15 years ahead of us in the approval process.
Got it. All right, we've got to wrap it up from there. All right, it's been a great pleasure to talk to you. I want to talk to you some more so we can continue this conversation. When you have new discoveries, you can bring them up to us.
Wonderful. Thank you. We sure will.
All right. Talk to you soon. Thank you. Don't forget, like us on Facebook, follow us on Twitter, and subscribe to our YouTube channel. You've been watching CEO Money with Michael Yorba. Thanks for watching.